The right ventricle, one thing that you want to look for is the right ventricle is going to go up. Do you see this vessel right here? This vessel right here is the pulmonary trunk. Okay, that's the pulmonary trunk. This one right here. So you can see right ventricle, pulmonary trunk. It's on there. That's the direction in which it goes. Okay. What I want you to remember is that the apex of the heart usually, I mean always, you see in these models, goes with the left ventricle. So you can see that the apex here, this is the left ventricle. Yes, this is the left ventricle. Both of those are the left ventricle, because when you close it, of course, it's one space. Yes. Okay. So when you open it up, you'll see that if this is the left ventricle, and you always want to use that as kind of your point of reference. Apex, this is the left ventricle. The left ventricle, you'll go to the left AV valve. Okay. The left AV valve is also called the mitral valve, and it's also called the bicuspid valve. Hence that little abbreviation that I put, LAM, left AV mitral valve, and bicuspid. And then from there, you'll see that you're moving upward into the left atrium. Okay, so you can see that this is also the left atrium right out here. This here, do you see this little thing? This is the left auricle. The left auricle is going to look kind of sort of like an ear. It's kind of sticking out. One of the characteristics of it is that it's going to have pectinate muscle in it. Do you see the pectinate muscle? Okay, you see those, all those ridges, okay, of muscle in the very close to the auricle are going to be pectinate muscle. All right, so that's pectinate muscle. Now, if you also note left ventricle, yes, you'll also see that these have the chordae tendineae, okay, that are going to attach the vessel. The chordae tendineae, which are these little cords right here. You'll see some of them here as well. Okay, chordae tendineae that are going to attach to the papillary muscle. That would be papillary muscle there, as is this papillary muscle right here. Okay. See the chordae tendineae attaching themselves there? Okay. Now, if you were in your left ventricle and you want to move out of your left ventricle, you would go through right there. By the way, this is your best instrument today. You're going to go out through like this, okay? And so you know right here, this is the aortic valve. You can see kind of there, floppy, okay? That's your aortic valve. There's a little bit more of it on this side right here, okay? Because we kind of cut the way we cut through it, okay? And then it goes obviously out into your aorta. This up here is your aorta, okay? By the way, this attaches right there, which actually makes this is the arch of the aorta. This would be the first blood vessel off of the aorta, which is the brachiocephalic trunk. I want you to look at the structure of both of these very large vessels. Notice that they're quite firm, okay, that they're quite hard, and that the wall is quite thick, okay? That is going to be kind of characteristic of these larger arteries that move blood away from the heart. Whereas, if you're looking for the veins, example right here, here's your vein. Notice that the vein is floppier. You see, it's thinner, the wall is thinner, and it's softer. Okay. Now, how can we verify that this is the superior vena cava? Well, how we're going to do that is, right, we know that this is the left ventricle. Yes, this is the right ventricle in here. This is the wall of the left ventricle. We call the myocardium of the left ventricle. This would be the interventricular septum in between the two ventricles. And then that makes, of course, this going to be the right ventricle, just for verification purposes. Okay? Right ventricle? Yes? Did I say that wrong? No? Well, if you look in the right ventricle, same thing with the left ventricle, by the way. You'll see a bunch of ridges in the right ventricle. That's going to be the trabeculae carneae. It's the same thing in here. Trabeculae carneae. Okay, those are like the rigid lines of the ventricles, whereas the pectinate muscle is found more here, okay, in the atria. Okay, so now we know that this is the right ventricle. So obviously, this thing right here is going to be the right AV valve, also called the tricuspid valve. Okay, you can see that right here, floppy thing. You can see the chordae tendineae and the papillary muscles to which they're attached. Yes. Now, if you could going a little further up, you are in the right atrium. The right atrium also has lots of this pectinate muscle. Do you see that? Lots of that pectinate muscle. And then now we were verifying superior vena cava comes into the right atrium. Well, it's coming in the right place, so that's got to be it. Okay? Now, we want to also find the inferior vena cava. That's going to be this one right here. Inferior vena cava. Superior vena cava, but look, see? Definitely coming into the right place. Okay, that's the right atrium up here. This inferior vena cava is coming in right in there. They're both coming into the right atrium. Like I said, most important tools today. Okay, now I mentioned this is the left atrium, right? This is the left ventricle, left AV valve, mitral valve, bicuspid. This is definitely has to be the left atrium. This is the right atrium. Now see, between the left and right atrium, if we can find a little spot meets up between the left and right atrium, I'll put my fingers in there again so you can see. I'm kind of looking for it in the back because I know that it's in the back. You see one finger here? This is the right atrium. Another finger here is the left atrium. Notice they don't reach in between. But look what we have here. That little circular thing. Really pretty circular thing. Do you see that? Right. Who's recording me? Okay, do you see it?
Yeah.
Okay, do you see that circular thing right there? That's the fossa ovalis. See? Right, and my finger's right on the other side. See, it's broken a little bit, so thin that I kind of broke right through it with my nail, okay? Does everybody behind me see that? Remember, this is the right atrium over here. And so right there, that little circular thing where it meets with the left atrium, that's the fossa ovalis. See it? Everybody see it? Pretty cool one. Very pretty one, by the way. Picked a good one. Okay, let's see. What else am I missing? I've mentioned everything on the paper. Oh, the pulmonary trunk. The only thing I didn't mention was the pulmonary semilunar valve. Okay, you can sort of kind of see it down in there. You sort of see it down in there. Like a little floppy stuff in there.
Yeah.
Okay, that's your pulmonary semilunar valve. And how we can verify that? Okay. Putting your fingers through. Do you see my finger in there? Okay. So definitely, right, you're going in through them. This is the right ventricle, and you're coming out over here. My finger. Okay, definitely going to be, that's the pulmonary trunk. From the left ventricles, that's the right ventricle to the pulmonary trunk. This is the left ventricle. Up this way, you see that's the aorta. Okay, so you always want to start with your understanding that wherever the apex is, the ventricle right above it is the left ventricle. I think if you work your way as like trying to identify things like that, I think you'll be okay. Sounds good? Okay, if there's anything I forgot to mention, what is it? Did you read there? Is there anything I forgot?